According to the 2024 Nutrition Situation Report, stunting remains prevalent, with statistics showing that 1 in 4 children under the age of 5 is stunted. According to the report, 26% of children under the age of 5 are stunted, 10% of newborns are of low birth weight, 3.2% of children are wasted, while 3.4% of children are overweight.
These worrying nutrition statistics are attributed to the poor quality and quantity of diets for children. Only 1 out of 10 children are fed on the right diet in terms of quality, quantity, and diversity of food groups.
The report further shows that stunting is highest among the boy child and is higher in rural areas. In terms of distribution, Karamoja sub-region still has the highest levels of stunting at 43.9%, with Teso posting the least with 13.9%. The Director for Methodology at Uganda Bureau of Statistics, James Mwange, says overweight does not only affect children, but adults too, with women most affected.
So in terms of region distribution, we see that almost half of the women in Kampala are overweight, either overweight or obese, and compared to other regions. And so we looking at the distribution. Of course, it's not surprising Karamoja has very few, given that it has extreme cases of deficiencies in nutrition.
The report has further shown an increase in anemia in all regions apart from Western.
And we realize that those who are not pregnant have a higher levels of anemia. But also in terms of regional distribution, we see that there are regions, northern region, apart from Western, where the anemia levels decline, there seems to be an increase in the rest of the region.
Now representing the Nutrition Development Partners Group, UNICEF's Chief Child Survival and Development Section, Dr. Yoram Wallman, says consequences of malnutrition are profound and far-reaching.
When insufficient dietary intake of essential nutrients can cause the greatest harm to child survival, physical growth, and cognitive development, trapping children and the families and communities in a vicious cycle of poverty and deprivation.
He says while the country's progress in addressing nutritional challenges is applaudable, it is less than desirable.
To address child malnutrition and child food poverty, the government and its development partners must invest more in the right interventions to improve children's access to diverse and nutritious diets and end malnutrition and undernutrition in all its forms.
He has also appealed to government to integrate nutrition in social development programs like UEP and SAGE. Meanwhile, the Prime Minister, Robin Nabanja, represented by the Minister for General Duties, Justin Kasule Lumumba, acknowledged the challenge in nutrition, calling for increased collaboration and partnerships.
These figures underscore the urgency of scaling up interventions that target nutrition and health outcomes. This dialogue provides a timely opportunity to reaffirm our commitment and align efforts under frameworks like the Sustainable Development Goals and the African Regional Nutrition Strategy. By doing so, we are not only addressing malnutrition, but also paving the way for Uganda to achieve middle-income status.
With a reduction of just 3.5% in stunting here in the country, Uganda is unlikely to hit the SDG target. Now, development partners and stakeholders are calling for greater investment in childhood nutrition if this challenge is to be addressed. I'm Benjamin Jumbe reporting from Munyonyo.